My name is Dina Westermeyer. I'm recording this for the University of Arizona Global Campus, Dr. Trednick, and it's due September 14th, 2024. What are dopamine receptors? Dopamine receptors are a class of G protein coupled receptors in the brain that mediate the effects of dopamine, a neurotransmitter involved in regulating mood, motivation, and motor control. There are 5 known types of dopamine receptors, D1 through D5, which are grouped into 2 categories. D1-like receptors, D1 and D5. These receptors primarily stimulate the product of cyclic AMP inside cells, leading to excitatory effects. They are involved in functions such as regulating voluntary movement and reward paths. D2 receptors, D2-like receptors, D2, D3, D4, these receptors inhibit CAMP production, often leading to inhibitory effects. They're essential in controlling motor function, reward, and modulating certain moods and cognitive functions. When dopamine binds to these receptors, it activates or inhibits various neural pathways depending on the receptor type, the location of the brain. This receptor activity influences behavior, emotion, and physical movement. Dopamine blockers, such as antipsychotic medications, typically target D2 receptors to reduce dopamine's excitatory effects and conditions. The history of dopamine antagonists began with the discovery of chlorpromazine in the 1950s, which changed the treatment of psychosis. Its effects were believed to result from inducing hypothermia, but further research revealed that chlorpromazine and other antipsychotics such as haloperidol work by blocking dopamine 2 receptors. This discovery led to the development of dopamine hypotheses of antipsychotic action, which suggests that psychotic symptoms, particularly in schizophrenia, were linked to the overstimulation of dopamine receptors. As the understanding of dopamine pathways advanced, other drugs were developed to address dopamine deficiencies in conditions like Parkinson's disease, further highlighting the importance of dopamine modulation in both psychosis and motor disorders. Research in the 1960s and 70s demonstrated that blocking 60 to 80% of D2 receptors was essential for managing psychotic symptoms without causing excessive side effects. The introduction of second-generation antipsychotics such as clozapine marked a shift in treatment by targeting both dopamine and serotonin receptors, resulting in fewer motor-related side effects. Oral administration of D2 blockers such as haloperidol and risperidone remain the most common methods, but often lead to fluctuations in drug levels and can cause significant side effects like tardive dyskinesia. Intranasal delivery bypasses the blood-brain barrier, delivering the medication directly to the brain via the nasal passages. It allows for quicker drug action and reduces peripheral side effects. Subcutaneous programmable mini pumps provide continuous subcutaneous delivery of medications like haloperidol. This method allows for steady drug administration and reduces the peaks and troughs associated with oral medication. Transdermal patches provide continuous and stable dopamine receptor stimulation without the fluctuation in drug levels that come with oral administration. Common dopamine antagonists and partial agonists, D2 blockers. Haloperidol, it's a atypical antipsychotic. It's first generation, frequently used in treating schizophrenia and other psychosis. It's known for its potent dopamine 2 receptor. Chlorpromazine, a first-generation antipsychotic that acts on dopamine receptors, and it's used to treat various psychiatric disorders. Risperidone, an atypical second-generation antipsychotic that blocks dopamine D2 receptors and serotonin receptors. Aripiprazole, a dopamine D2 partial agonist, which acts as both antagonist and agonist depending on the dopamine levels in the brain. Brexpiprazole, another D2 partial agonist like aripiprazole, is used to treat schizophrenia and other disorders. Cariprazine, also a D2/D3 partial agonist, this medication is less likely to cause movement disorders and is used for schizophrenia and bipolar disorder. Common side effects of dopamine blockers include extrapyramidal effects such as tardive dyskinesia, dystonia, Parkinsonism, akasia, tremors. These side effects result from the blockade of dopamine receptors in the brain, leading to impaired motor control and coordination. Additionally, dopamine blockers can cause sedation, weight gain, and prolactin elevation, which may result in conditions like galactorrhea and sexual dysfunction. The psychological consequences of D2 blockers can include cognitive impairment, emotional blunting, and depressive symptoms. These medications, by reducing dopamine activity, may impair motivation and lead to a reduced sense of pleasure, contributing to a condition known as anhedonia. Additionally, the risk of developing movement disorders like tardive dyskinesia can cause significant psychological distress, anxiety, and frustrations as patients struggle with involuntary movement that affect their daily function. These side effects can further exacerbate feelings of isolation and depression. Dopamine blockers, partially those used as antipsychotic medications, cause tardive dyskinesia by continuously blocking dopamine D2 receptors in the brain. This prolonged dopamine receptor antagonism leads to compensatory changes such as an upregulation of dopamine receptors, making neurons hypersensitive to dopamine. This hypersensitivity is believed to result in abnormal involuntary movement, characteristics of tardive dyskinesia. First-generation antipsychotics like haloperidol and chlorpromazine, which strongly block dopamine receptors, are more likely to induce tardive dyskinesia compared to second-generation antipsychotics. Tardive dyskinesia is a movement disorder characterized by repetitive involuntary movements, primarily affecting the face, tongue, lips, and sometimes the limbs and trunk. It often occurs after prolonged use of dopamine-blocking medications such as antipsychotics and can persist even after the medication is discontinued. Approximately 20 to 30% of patients who use dopamine blockers for an extended period develop tardive dyskinesia, with a higher prevalence among those treated with first-generation antipsychotics compared to second-generation antipsychotics. Dopamine blockers, particularly antipsychotics, have been linked to significant reproductive effects, including reduced sperm quality, hormonal imbalances, and negative impacts on embryonic development. These drugs can disrupt the hypothalamic pituitary gonadal axis, leading to decreased testosterone levels and impaired reproductive functions in men. In women, dopamine blockers may cause menstrual irregularities and fertility issues due to elevated prolactin levels, which can suppress ovulation. Additionally, the oxidative stress induced by these medications can result in DNA fragmentation and other cellular damage that compromise reproductive health. The social consequences of using D2 blockers in developing tardive dyskinesia can be profound. Patients often experience involuntary movements, particularly in the face and limbs, leading to embarrassment, social isolation, and difficulty maintaining personal and professional relationships. The visible symptoms of tardive dyskinesia, such as facial grimacing and tongue movement, can cause stigmatization, further contributing to anxiety, depression, and a diminished quality of life. These challenges can hinder a person's ability to engage in daily activities and maintain employment, compounding the social and emotional burden. While D2 blockers play an important role in treating dopamine-related disorders, they come with significant risks, including cognitive impairment, emotional blunting, and reproductive side effects. These medications can affect patients' quality of life, impacting their psychological well-being and social functioning. As research continues, the exploration of alternative therapies, including drug-free options such as cognitive behavioral therapy or lifestyle interventions, offer hope for managing these conditions without the long-term consequences associated with dopamine blockers. Developing holistic approaches could provide patients with more sustainable, side effect-free treatment options in the future.